Imagine your body like a pressure-controlled engine. When the pressure is released at the right time, everything runs smoothly. But when that release is blocked again and again, the system starts to struggle, performance drops, and warning signs slowly appear. This is exactly what happens in older men when ejaculation becomes rare, difficult, or stops completely. This is not just a bedroom issue. It is a serious health signal your body is sending, and it should be fixed immediately. Many men over 40, 50, or 60 quietly accept this change. They think, this is just aging, or they feel embarrassed and avoid talking about it. Some blame stress, some blame work pressure, and others simply ignore it. But modern medical science tells a very different story. Regular ejaculation is not only about pleasure, it plays an important role in prostate health, hormone balance, blood circulation, and even mental well-being. When ejaculation is reduced or absent for long periods, silent health problems can begin to develop inside the body. To understand why this matters, you first need to understand how ejaculation actually works. It is not just a muscle reaction. It is a complex process involving the brain, nerves, hormones, blood vessels, the prostate, and pelvic muscles. Sexual arousal starts in the brain. Signals travel through the spinal cord to the pelvic nerves. Blood flow increases to the penis. The prostate and seminal vesicles produce fluid. Finally, coordinated muscle contractions lead to ejaculation. If any part of this chain is weakened by stress, diabetes, nerve damage, low testosterone, medication side effects, or prostate enlargement, ejaculation can become weak, delayed, or stop altogether. One of the most common causes in older men is hormonal imbalance, especially declining testosterone. Testosterone is not just about desire. It directly affects semen production, orgasm strength, nerve sensitivity, and the ejaculation reflex itself. As men age, testosterone naturally declines, but lifestyle factors can accelerate this drop. Poor sleep, excess belly fat, lack of physical activity, chronic stress, alcohol, and processed foods all push testosterone lower than it should be. When levels fall too much, the brain sends weaker sexual signals, the prostate becomes less active, and ejaculation becomes difficult or unsatisfying. Another major factor is prostate health. The prostate plays a key role in ejaculation by producing seminal fluid and helping push semen out. As men age, the prostate often enlarges, a condition known as benign prostatic hyperplasia. This enlargement can interfere with semen flow and weaken ejaculation. In some cases, men experience dry orgasms or very low semen volume. Over time, reduced ejaculation can also lead to fluid buildup, inflammation, and increased prostate discomfort. Blood circulation is another silent issue. Healthy ejaculation depends on strong blood flow, not just to the penis, but to the pelvic region as a whole. Conditions like high blood pressure, high cholesterol, and insulin resistance damage blood vessels. When circulation weakens, erections become softer, arousal takes longer, and ejaculation loses strength. Many men focus only on erections, but ejaculation quality is often the earlier warning sign of vascular problems. Mental and emotional factors also play a powerful role. Chronic stress keeps cortisol levels high, which directly suppresses testosterone. Anxiety activates the nervous system in a way that blocks ejaculation reflexes. Depression reduces sexual motivation and brain signaling. Even years of performance anxiety or relationship tension can retrain the brain to suppress ejaculation without the man realizing it. The dangerous part is that many men assume less ejaculation means less sexual need, but biologically, the opposite often happens. When ejaculation is absent for long periods, prostate secretions stagnate, pelvic muscles weaken, and nerve responsiveness declines further. This creates a vicious cycle where the body slowly forgets how to perform a function it was designed to do regularly. The good news is that in most cases, this condition is reversible. The male body is highly adaptive, even at older ages. When the right signals are restored hormonal, nutritional, neurological, and circulatory, the ejaculation response can return stronger and healthier than expected. But it requires understanding the real causes and acting early, not ignoring the signs. In the next part, we will break down exactly what happens inside the body when ejaculation is suppressed for too long, the hidden risks men rarely hear about, and why fixing this issue goes far beyond sexual performance. It can protect long-term male health. When ejaculation becomes rare or stops altogether, the body doesn't just pause that function, it starts adapting in unhealthy ways. One of the first things affected is the prostate. The prostate is designed to regularly produce and release fluid. When that fluid is not released, it can become thicker and more inflammatory. Over time, this stagnation may increase discomfort, pelvic pressure, and irritation during urination. Several long-term observational studies have also found that men who ejaculate less frequently tend to have higher risks of prostate-related issues compared to men with regular sexual release. Another silent change happens in the pelvic floor muscles. These muscles are responsible for the rhythmic contractions that create ejaculation. Like any muscle in the body, if they are not used, they weaken. Weak pelvic muscles lead to reduced ejaculation force, delayed climax, or the inability to ejaculate at all. Many older men assume this is a nerve issue, but in reality, it often begins as simple muscular deconditioning that slowly worsens over time. Nerve sensitivity is also affected. Ejaculation depends on healthy communication between the brain and the spinal reflex centers. When ejaculation does not occur regularly, nerve pathways become less responsive. This is similar to how reflexes slow down when they are not used. Over time, the brain's sexual signaling becomes quieter, making arousal harder to sustain and climax more difficult to reach. Hormonal feedback loops are another overlooked problem. Regular ejaculation helps regulate testosterone and dopamine activity in the brain. Dopamine is the motivation and pleasure chemical that drives sexual interest. When ejaculation is suppressed, dopamine signaling weakens, reducing desire and sexual confidence. This creates a cycle where low desire leads to less ejaculation, and less ejaculation leads to even lower desire. There is also a cardiovascular connection that most men never hear about. Ejaculation is part of a full sexual response cycle that requires healthy blood vessel function. When this cycle weakens, it often reflects early blood vessel dysfunction elsewhere in the body. In many men, changes in ejaculation quality appear years before serious heart or metabolic problems are diagnosed. In this way, sexual function acts like an early warning system for overall health. So, how do you fix this? The solution is not found in quick pills or extreme supplements. It begins with restoring the body's natural signals. The first priority is improving testosterone-supporting habits. Deep, consistent sleep is critical because most testosterone is produced during deep sleep cycles. Even 1 week of poor sleep can significantly reduce hormone levels. Strength training, especially leg and core exercises, stimulates natural testosterone release and improves pelvic blood flow. Reducing excess sugar and processed foods helps lower insulin resistance, which protects hormone balance. Nutrition plays a major role as well. Zinc, magnesium, vitamin D, and healthy fats are essential for semen production and nerve function. Dehydration alone can reduce semen volume and orgasm intensity. Many older men are chronically dehydrated without realizing it. Proper hydration improves blood viscosity and supports prostate fluid production. Pelvic floor activation is another powerful but underused tool. Gentle pelvic contractions, when done correctly, can rebuild ejaculation strength over time. These exercises improve muscle coordination and nerve responsiveness. Within weeks, many men notice improved control and stronger climaxes. Mental health cannot be ignored. Chronic stress keeps the nervous system in a defensive state that blocks ejaculation reflexes. Simple daily stress reduction practices, such as slow breathing, light walking, or mindfulness can restore nervous system balance. Sexual function improves naturally when the brain feels safe and relaxed. Finally, consistency matters more than intensity. The male reproductive system thrives on regular stimulation and release. Whether through partnered intimacy or healthy solo activity, regular ejaculation helps maintain prostate health, nerve signaling, and hormonal balance. Avoiding ejaculation out of fear, shame, or misinformation often causes more harm than good. In the final part, we will bring everything together and explain how older men can safely restore healthy ejaculation, what warning signs should never be ignored, and when medical support may be necessary to prevent long-term damage. Restoring healthy ejaculation in older men is not about chasing short-term performance, it's about rebuilding the body's natural rhythm and communication system. The first step is assessment, understanding your current hormonal levels, prostate health, circulation, and overall fitness sets the foundation for targeted improvement. Blood tests for testosterone, PSA prostate-specific antigen, and basic metabolic panels can reveal hidden problems before they become serious. Don't wait until pain, discomfort, or severe sexual dysfunction appears. Prevention is always easier than repair. Once you know your baseline, lifestyle adjustments become the most powerful tool. Exercise is non-negotiable not only for testosterone, but also for blood flow. Compound movements like squats, lunges, and deadlifts, combined with core and pelvic floor exercises, improve both hormonal balance and the strength of the muscles involved in ejaculation. Even daily brisk walking or cycling stimulates circulation and boosts oxygen delivery to tissues critical for sexual function. Nutrition is equally crucial. Healthy fats, like those from nuts, olive oil, and fatty fish, support hormone production. Micronutrients like zinc, magnesium, and vitamin D are essential for prostate health, semen quality, and nerve function. Minimizing processed foods, refined sugar, and excess alcohol reduces inflammation and improves vascular health. Hydration, surprisingly, is one of the simplest yet most overlooked factors. Proper fluid balance ensures optimal semen production and prostate function. Mental health and stress management complete the puzzle. Chronic stress elevates cortisol, which directly suppresses testosterone and reduces sexual responsiveness. Relaxation practices such as meditation, deep breathing, or even short daily nature walks can restore nervous system balance. Coupled with positive sexual experiences, whether alone or with a partner, these practices retrain the brain to recognize sexual cues and respond with full vigor. For men with medical conditions like diabetes, high blood pressure, or prostate enlargement, professional guidance may be necessary. Certain medications can affect ejaculation, and adjusting them under a doctor's supervision can make a dramatic difference. In some cases, hormonal therapy, minimally invasive prostate procedures, or nerve-focused interventions can restore function safely. The key message is this: ejaculation is a vital sign of male health, not just a measure of sexual pleasure. Regular, healthy release maintains prostate function, hormone balance, circulation, and nervous system health. Ignoring changes, or assuming it's just age, can silently erode multiple systems, while proactive restoration can dramatically improve quality of life, energy, confidence, and intimate connection. By understanding the body, supporting it with proper exercise, nutrition, mental care, and medical guidance when necessary, older men can not only regain healthy ejaculation, but also safeguard long-term health. Age may slow the process, but it doesn't have to stop it. Your body is capable of responding, repairing, and thriving if given the right signals and support. The truth is simple: ejaculation is not a luxury, it's a vital part of male health. Ignoring its decline is like ignoring warning lights on a car dashboard. Every delay, every weak release, every dry orgasm is your body signaling that something needs attention. But the good news is that the solution is almost always within your control. By supporting your hormones, strengthening your pelvic muscles, improving circulation, eating wisely, managing stress, and seeking medical guidance when necessary, you can restore this essential function often better than before. Age may change your body, but it does not have to rob you of vitality, confidence, or pleasure. With consistent action, awareness, and care, older men can not only fix ejaculation issues but also enhance their overall health, energy, and well-being. Don't wait for a problem to become serious. Start today, listen to your body, and reclaim a vital part of your manhood.